How's it going, guys? Before I start this video, please like and subscribe. So in my next video, I'll be giving a new subscriber a shout out, so stay tuned for that. So anyways, I'm currently in the hospital right now because I had a 105 fever from an infection from a wound that currently opened up. So the pressure sore is where the flap is at, and it just a lot of friction from the underwears. It made it into like a rug burn kind of pressure sore, which ended up later becoming open and getting infected. And they CAT scanned me and they found fluid buildup where the flap was at, and they're going to be doing an aspiration, which I had done previously. And since they're at that, they might as well tie in the flap because it loosened over time. So what an aspiration is they'll be taking like a long needle like that, and they'll be injected inside you, and they'll just take out any fluids that's inside in that affected area, and they'll just test the fluid and see if it's infected or not. And the old wounds I had before, actually old wounds from the first year, and also when I was still learning about pressure sores, and also being paralyzed, we actually heal much slower than most. So I was in rehab for about 3 months, 2 months inpatient and a month outpatient. So I'm pretty familiar with always moving and rotating to prevent pressure sores. So here's some pictures of me when I was in rehab. So I had a fractured lumbar spine from my injury, so I had to wear a shell brace, and I used to sleep with it, I used to shower with it, and I didn't really take it off until I knew my back was healed. So it later ended up causing a pressure sore, which ended up becoming much severe and ended up getting infected. And I had a fist-sized hole on both sides of my hip, and my left side healed about 5-6 months, and my right side, it just healed much slower. And it ended up going to the bone where it got infected, where I had to go through surgery for that to do a bone scrape. And they're almost telling me that I almost had to get my leg amputated. And I went to 2 different kinds of surgeries. The first one, they did a bone scrape and they had to test the bone, and also they did deep cleaning at the same time. And then after that, they hooked me up to a wound vac to suck out any bad fluid. Second surgery, after they figured out what kind of bacteria was in my bone from the first surgery, they ended up putting a wound flap on my hip. And what a wound flap is they'll take a piece of skin and muscle tissues and stuff, and they'll put it in the affected area. So they got a piece of my leg and they put it on my hip. And after my surgery, I had a home nurse take care of my feet, which I ended up having pressure sores from being bedbound for about a month and a half. And I have a home nurse for at least 5-6 months, and she comes at least 3 times a week. And she only uses what the doctor prescribes, or else she'll get in trouble. And I see the foot specialist at least every 2-3 weeks. And my mom, or sometimes my dad, has to drive me at least an hour or so just to go see the foot specialist. So shout out to my mom and dad. So give my parents some appreciation by giving this video a thumbs up and by leaving a comment below. So anyways, I'll be showing you some wound care products and my personal experience with them, so let's begin. When you're cleaning your wounds, it's important to wear gloves. When cleaning your wounds on your bed, it's helpful to use a chuck, a dog pad, or even a towel to help prevent mess and spills. They got different kinds of chucks. Some are thicker than most, but if you don't have none of that, then you can just use a towel. And those that don't know what a chuck is, this is what a chuck is. It's pretty much similar to a dog pad, but like I said, if you don't have that, then you could just use a towel. So I'll tuck it under me so when I pour saline or use a wound cleaner that comes in a spray bottle, it won't make much of a mess. And then when I'm done, I'll just put everything in the pad and I'll just throw it away. Speaking of products, I'll be showing you some things that clean my wounds. I use saline when I be cleaning my wounds. They come in big bottles or small bottles. Unfortunately, I don't have that here since I'm at the hospital, so I can only show you what I can. But the stuff that I have, I'll be showing you guys. With saline, it can only stay fresh for a certain amount of time once you open it, according to the doctors. After that, it gets bad. So it's pretty much like a one-time use thing. And if you don't have that, then you could use this. It's a wound cleaner that comes in a spray bottle, and it lasts longer, unlike the saline. And some nurses use iodine to clean their wounds, and they also use this during surgery. And this is what it looks like. Then they also have this. It's called ChloroPrep Single Swab, and I actually prefer this since it leaves less of a residue. And this is what it looks like. It smells like rubbing alcohol, which I think it cleans much better. And then I also started using this when I do my cathing, since like I mentioned, it leaves less of residue, and I also feel it cleans much better. And I also like to mention with saline, I prefer pouring it on than just dabbing it on a 4x4 and cleaning it that way, because I feel like it cleans the wound much better when you're washing it away versus just put it on the 4x4. And that's why you need a chuck, because when you'll be pouring the saline. And speaking of 4x4, this is a 4x4. It comes in this kind of container, or sometimes it comes like in a gray package. And this is what it looks like. And if you don't want to use that, they also make like a pre-made 4x4. And what it is, it's like pretty much like a square napkin instead of making a couple of them to build the thickness. And if you have a bigger wound, then you should use an abdominal pad. And this is what it looks like. And it doesn't have a sticky part like it does on a bandage, so you will need to use tape. And if you don't want to use that, then you can use this border wound foam dressing. And this is what it looks like. And there's different sizes as well. Do not like to use these because as a paraplegic, I sweat a lot. So it just traps a lot of moisture and it just soils the bandage. And when using those, you gotta keep an eye on it because moist wounds can cause breakdown much quicker, and also bacteria can form and then can get infected. So that's why I prefer the 4x4 so it can breathe. And when using this, you do need to tape it. If not, then you can just use this kind of white roll and it's just breathable. And this is what the roll looks like. And what you'll do, you'll just wrap like your foot or your hand or wherever it's at, and it just allows your wound to be able to breathe. So Dead Press asked, what was that padding on top of my foot on that wound care video I showed, and the video is right here. And what it is, it's called Medblix Heals. They don't have it at the hospitals, unfortunately. Something you gotta give through your doctor. And it's meant for your heels, but my doctor used it for the top so it could like protect like the bony parts. Now for the ointments that I use or used to use. Now some concepts aren't set in stone and some things are meant to be changed because one isn't for all. And if something's not working in at least a week, then you should change it. So Kathleen Chavez was asking why I don't use Aquaphor on my wounds, and the reason why is because my foot doctor says it's bad to add more moisture if it's already too moist. So that's why I use Decident to dry it out a bit, and my feet have healed much quicker. And if your wounds are red or irritated, then you should use Neosporin or what they'll call triple antibiotics. And you'll need something to help an irritated wound, and Aquaphor wouldn't help to calm it down. And it's not good to add moisture on an infected area. So it's something you gotta keep an eye on. So if your wound is just too dry, then you should use Aquaphor, but if it's too moist, then you should use Decident. But if it's infected, then that's something else, because you'll need something to fight the infection and also wick away the moisture. So my home nurse used triple antibiotics on my wounds, and it's to help prevent it from sticking. Also, it adds like some good bacteria to it. And it's important not to add bandage dry because it could stick to your skin and it could reopen. But on my hip, they used to use Santal, and it's a very popular product because it helps eat away all the bad bacteria, but that's something you gotta get prescribed. And then there's also this honey product, and they use that on my feet for like a pressure sore, and it's very good too. And in the beginning they used to use hydrogel to moisture the wound, but in the hospitals they don't like to use that, especially if the wound's infected, or at least at the hospital that I'm at. And like I said, too much moisture is bad where bacteria can grow, and also it leads to more skin breakdown. Also, using some bandages can cause more harm than good. So the ointment and the kind of bandages, it all depends what your doctor recommends. The hydrogel also comes in a tube container, and it's called Skin Grady, and that's pretty good, especially if you're traveling, you gotta take care of your wounds. So with my old wounds, they're always wet because of an infection, and it was always seeping through my bandages, and I had to change it at least 3 times a day. So applying all these moisture kind of products and using the unbreathable kind of bandages, it actually did more harm than good, and it led to an infection. So as you can see, not all ointments are the same, so you should use whatever your doctor recommends. And if you're dealing with wounds that are too wet, then you should pack it, and you could just use these 4x4s, or you could just use like these strips, and this is what it looks like. So if it's that bad, then you should ask your doctor to use a wound vac. And so packing it, what it does, it helps wick away all the moisture. So with my hip, when it was open, what they did, they packed it wet to dry. And what the concept is once it dries, it peels away all the dead skin. And what they'll do is they'll just use a 4x4 and wet it with saline, and they'll just pack it. It's almost like using duct tape or a lint roller to get some fur off your couch or your shirt. And speaking of skin, nurses will use zero foam over your wounds, and I'll actually recommend using gloves for this. And this is what it looks like. And so what it does, it adds a little moisture to keep it healthy and also keep the bandage from sticking. Then for the tapes, there's thin tapes, then there's thick tapes. I prefer the thick tape since it covers more. And with the thinner tapes, you see it only covers a little bit, and so it'll keep unsticking. So that's why I prefer like the thicker tapes. And some tapes are breathable unlike the others. I prefer using this since it helps your wound breathe more versus this one. It's almost like a regular school tape. and you also gotta be careful with some kind of takes because some people have an allergic reaction to some. So I'm pretty sure there's more other stuff out there, but these are the things that I've used. So if there's other stuff that you have used, please leave it in comments below. So anyways, that's the video for today. So hopefully the video can help others to prevent them from going through surgery like I did and I am still currently going through. And like I mentioned, I'll be giving a new subscriber a shout out, so stay tuned for that in my next video. So anyways, this video was helpful or entertaining. Don't forget to like and subscribe, and I'll see you next time. Bye.